and welcome back to Afroturk TV. I'm Başak Çetiner Baksu, Professor of Obstetrics and Gynecology from Istanbul, Turkey. Today, we reach the climax of pregnancy, delivery and birth methods. Many women feel excitement, but also uncertainty and fear. This is the moment every mother anticipates. But how does birth happen? What are the options? And how do doctors guide mothers in choosing the safest path? Understanding how birth happens and what options exist helps women feel informed, prepared, and confident. Let's explore together. Birth is the transition from pregnancy to motherhood. There are three main ways a baby may be born. First, spontaneous vaginal birth. Second, assisted vaginal birth using vacuum or forceps. And third, cesarean section, which is a surgical procedure. Every method has its place. Every method has its indications, advantages, and possible risks. Each is safe when medically indicated. The goal of every medical team is always the same: a healthy mother and a healthy baby. Let's begin with the vaginal delivery. Vaginal birth is the natural process of delivery. Labor begins with regular uterine contractions, which gradually open the cervix. When the cervix reaches about 10 cm in diameter, that is when we say fully dilated, and the baby moves through the birth canal with the help of the uterine contractions and also the mother's pushing. This process is usually occurring in three stages. First, opening of the cervix. Second, birth of the baby. Third, and finally, after the baby is born, the placenta is delivered. This is the most common form of childbirth when pregnancy progresses normally. What are the advantages of vaginal birth? Recovery is usually faster. Mothers can walk and move around sooner. Hospital stay is typically shorter. There is, of course, no abdominal surgery and therefore less surgical risks. Lower rates of infection. Babies born vaginally often adapt more easily to breathing because fluid is squeezed through the lungs during labor. In addition, skin-to-skin contact and breastfeeding often begin sooner. For many women, vaginal birth is considered the safest and the most natural option when pregnancy is uncomplicated. However, vaginal birth is not without challenges. There is risk of prolonged labor, risk of perineal tears or episiotomy, heavy bleeding after delivery, risk of fetal distress, rarely injury to the baby during difficult delivery, pelvic floor weakness, sometimes leading even to incontinence after delivery. Most of these complications can be managed safely with proper medical care. Sometimes during the final stage of labor, the baby may need extra help to be delivered safely. This is where assisted vaginal delivery comes in. This means the baby is still born through the birth canal, but special medical instruments are used to assist the final stage of birth. The two commonly used tools are vacuum extraction and forceps. These tools help the baby through the birth canal while the mother is still continuing to push. Assisted delivery is usually considered when the baby is already low in the birth canal, but delivery needs to happen more quickly. In vacuum-assisted delivery, a small soft cup is gently placed on the baby's head. The doctor then uses gentle traction together with the mother's pushing to help guide the baby outside through the birth canal. This method is commonly used when the baby is already loving the birth canal but needs assistance to complete the delivery. Another method of assisted delivery is forceps. Forceps are special medical instruments that look like curved spoons. These are carefully placed around the baby's head to help guide the baby through the birth canal. This method is used less frequently today, but in experienced hands, it can be very effective. When is assisted delivery used? Assisted vaginal delivery can be recommended when the mother is exhausted and cannot push effectively, the labor has slowed during the final stage, the baby shows early signs of distress and needs to be delivered more quickly. In these cases, assisted delivery can help avoid an emergency cesarean section. The decision to use vacuum or forceps is always made carefully by the medical team. The goal is always the same: a safe birth for both the mother and the baby. When performed by trained professionals, assisted vaginal delivery can be a very safe and effective option. What are the advantages and risks of assisted delivery? Assisted vaginal delivery can help avoid an emergency, like cesarean section, when vaginal delivery is possible. It allows the baby still to be born vaginally. It shortens the prolonged labor. It helps in cases of maternal exhaustion or fetal distress. What are the disadvantages and complications of assisted delivery? As for every medical procedure, assisted delivery also has potential risks for the mother. There might be a higher chance of perineal or vaginal tears. For the baby, there is the risk of bruising and minor injury to the baby. There are rare complications like bleeding or infection. Assisted delivery is safe when performed by experienced hands, but it requires careful judgment. Now let's look at cesarean section. Sometimes vaginal delivery is not possible or safe. A cesarean section may be necessary. Cesarean section, often called C-section, is a surgical delivery. During this operation, the baby is delivered through an incision in the mother's abdomen and uterus. Cesarean delivery may be planned in advance or performed during labor if complications arise. Cesarean delivery is a life-saving procedure for both the mother and the baby when medically necessary. When is cesarean section necessary? There are several situations in which a cesarean section may be recommended. For example, if the baby is in an abnormal position, such as breech presentation, if the placenta blocks the birth canal, the condition called placenta previa, if labor does not progress normally, if the baby shows signs of distress, if it is a multiple pregnancy with certain risks, if the mother has placenta previa or certain medical conditions, or a previous uterine surgery like myomectomy. In these situations, a cesarean section may be the safest method both for the mother and the baby. In these cases, surgery saves lives. So a cesarean section is not a failure. It is a medical solution. What are the advantages and possible risks of cesarean section? Cesarean delivery can prevent serious complications during difficult labor. It is life-saving in emergencies. It may reduce risk when vaginal delivery is unsafe. With cesarean section, predictable timing in planned cases is possible. Trauma to the pelvic floor is avoided. However, because it is a surgery, it also has disadvantages. Recovery is longer, there is high risk of infection, bleeding, surgical complications, such as injury to the nearby organs. Increased risk in future pregnancies also includes placenta insertion anomalies that may require additional monitoring. A cesarean section is not a failure. It is a medical solution when needed. Is there a way for preparing for delivery? Birth is not only physical, it is emotional. Some women fear pain, others fear surgery. Every feeling is valid. Preparing for childbirth helps reduce fear and anxiety. Women can prepare by attending prenatal checkups, attending childbirth classes, learning about stages of labor, discussing birth plans with their doctor, discussing pain relief options, learning breathing and relaxation techniques, packing their hospital bags, preparing for breastfeeding, and ensuring support from family or partners. The key is open communication with healthcare providers so the mother feels informed and supported. As always, preparation and knowledge reduces anxiety and builds confidence. How do the doctors guide the decision? The decision about the method of delivery is based on several important clear medical criteria. These include the mother's previous birth history, the health of the mother, the health of the baby, the position of the baby, the size of the baby, the structure of the pelvis, the progress of labor, any complications detected. Doctors evaluate all these factors carefully and guide mothers based on evidence, safety, and individualized care. The decision is not about preference alone. It's about what is safest for the mother and the child. How is recovery after birth? Recovery differs by birth method. For vaginal delivery, hospital stay is shorter, returning to daily activities is quicker. For cesarean section, recovery is longer, more rest is needed, but it is safe with proper care. Both require support, nutrition, and emotional well-being. Unfortunately, myths persist. Some believe cesarean section are always easier. Others fear vaginal birth unnecessarily. Awareness is essential. Both methods are safe when medically guided. The choice must be based on health, not fear or misinformation. My advice to you is to trust your doctor, ask questions, prepare both emotionally and physically. And remember that the method of delivery does not define you as a mother. What matters is safety and love. My final message to you. Childbirth is one of the most powerful moments in a woman's life. Every birth experience is unique. Some women deliver vaginally, some require assistance, some need cesarean section. There should be no shame in either birth method. The most important goal is always the same: a healthy mother and a healthy baby. Delivery is the beginning of a new chapter. With proper care, medical support, and knowledge, women can approach birth with confidence. Safety and well-being are always the priority. To every woman watching, embrace your journey, trust your body, and trust your medical team. Together, through awareness and education, we can empower women everywhere. And remember, healthy mothers create healthy families, healthy societies, and a healthy future. Thank you for listening and see you in the next episode.